So yesterday, Marius, thanks very much. You tweeted that you were looking forward to presenting today. So I feel like I cut you off, okay? So please continue along a few of the points you were making when I got you to join the panel.
Thank you. I think that, as someone who's not in the health system or in government, but stands off from an academic perspective and looks from the outside, I think we have to appreciate the first thing, that underneath this debate sits an ideological battle, which essentially is about saying, can we best give health services to the population through the public sector, through a state-led initiative, or can we best do it through the market, through the private sector, through competition? Now, what arises from that ideological tension is the policy-making process as it is currently in the country. If I had to caricature that, and that's not just in this sector, we see this across the sectors, is we tend to have a government who runs ahead of the population with an ideological or ideologically informed policy perspective and then tries to tell the population or sell the population on that perspective. I don't think that that's the right policy process for a country like South Africa. What we need is much more participative democracy, co-creation of policy, much more engagement, much more dialogue at a substantive level to say, what are the realities on the ground? And so getting away from ideology to what we would call pragmatism, to say practically, how can we get South Africans better health, using what's in the public sector, using what's in the private sector? And then maybe two more thoughts to add to that. The one is that I think that there are tremendous low-hanging fruit in South Africa. We don't need to be sending experts and doctors to Japan if we can send them to a province down the road to learn from and to work with. But what that will require is not just talking about partnership or partnership at a shallow sort of advocacy level or a lobbying level, but substantive partnership where the stakeholders say, look, how can we make a 10-year, 15-year commitment to the country, and what is our role and contribution in that partnership of what's good for the country? And then to finish, I think the final thought is that perhaps the private sector in some instances has had blind spots. I like your idea about a low-cost model, but I think that some of the problems we have that we're waiting for the public sector to solve could probably be solved by the private sector taking the lead and then working to bring the public sector along on that journey. And to finish, I think the language of responsible collaboration or collaborating responsibly, I think, is critical to this.
Lerato, I'm going to thank you very much. I'm going to come back to you. Okay, so there was, see, you avoid the question of complementary role, No. So I don't know, have you got a position on that, or what's your sense? It seemed like the minister, and also on Monday in the business news, Anban Pillay at SASA, saying something a little bit different to how it's worded in the draft bill. Okay, that's the one thing. The second thing is I want you to pick up on Roly Base's point. He's speaking really about Alex van der Heever's NHI 1 and NHI 2 model. That if government would focus on fixing up what is wrong with the regulation of medical schemes, that is community rating, risk equalization, and that would go a long way to opening up. The problem with the low-income scheme is the regulatory framework, for instance. So what are your thoughts on that?
Okay, thank you. And no, I didn't avoid it. It's still coming.
Okay,
I think it was still early days then. So just to put it in perspective, the Health Funders Association supports government in all its endeavors to put together a universal healthcare system. So UHS, we all know, is an imperative. We have to implement this thing. It will be phased in over time, but I think at the Health Funders Association, what we're saying is we know the what is required. There is no debate around that. The thing is, how are we going to roll out universal health care? So it's really about the how. And when we look at it, one of the things that has come out of the bill that we are concerned about, but that one that we would like to engage with government on, is the role of schemes in the national health bill that has just come out. So if you recall in the green paper, there wasn't much really that was said on schemes. It was pretty much like you're outside the room. But there's been developments since then. And now with the white paper started introducing the complementary services that you now talk about. So, yes, schemes are now sort of in this bill given the responsibility of offering complementary services. But the question still remains, what does complementary specifically mean? What are we talking about? So let's define it so that we understand what the benefit structure package is going to be. What is NHI going to offer that we are going to be complementing? So, and that hasn't really been answered. So coming back to my point of saying, it's all about the how, and as we know now, obviously, the bill doesn't go into specifics. And really, the devil is going to be in the detail in terms of that.
So is this a scheme problem or an administrator problem? So a scheme's a non-profit, so what do they care? I mean, if we put all the pool, the funds, and it's a pooling problem, as is alleged in the Act, why is that a bad thing for schemes? And when I look at the kind of administration heavy, the Act is quite clear that they're going to carry on doing all of the things that administrators do. That is coding, billing, paying, and that. Why are administrators worried about this?
No, it is a worry because you actually spend time in budgeting and planning for the benefits. So you have to look at the population and consider the requirements of the patient. So if you do not understand what services you have to offer, how do you begin planning for that in your budgetary process? How do you begin putting together a comprehensive package of saying, this is what complementary is going to be? Is it going to be PMB, and we're talking prescribed minimum benefits? Is it going to be that kind of structure or not? So, it's imperative that we get that understanding way ahead of time. And yes, it affects both medical schemes and the administrators in that respect, because the administrators, yes, are administering the schemes and helping them with the, running of the business, submitting claims and the likes, and paying out the claims. But together, they need to be able to understand how to plan going forward.
Fantastic.